Good morning, everybody, and happy Hanukkah. Chances are that if you have not been touched by Parkinson's disease personally, someone you love or know will be, and soon. So now it turns out that members of our Jewish community have a possible role to play in unraveling some of the mysteries of this all-too-common disease. Dr. Jacqueline Rick has served as project manager of the clinical and educational core of the NIH-funded Udall Center of Excellence in Parkinson's disease at the University of Pennsylvania for more than 6 years. In this role, she has led the recruitment effort for the clinical research side of the center, which has enrolled over 300 people with Parkinson's disease. She has also led the outreach effort to recruit Jewish Parkinson's patients and their families for a study called the Parkinson Progression Markers Initiative Study, sponsored by the Michael J. Fox Foundation, thus the picture of Michael J. Fox that graces our stage. In this role, she's worked with research advocates to educate and network with patients' communities and given many presentations, such as the one that we'll be enjoying this morning. Myra Hirschhorn, in addition to being a very dear friend and familiar to many of us in the community, has been an active volunteer with the major national Parkinson's disease organizations and has served as a facilitator for support groups provided through Lionsgate, Willingboro, and Virtua Memorial Hospital. Working through the Michael J. Fox Foundation, she volunteers in the PPMI genetics program, encouraging Ashkenazi Jews to spread the word regarding the genetic connection to Parkinson's. She's also won the prestigious Louis Fishman Award given by the Parkinson's Action Network, and she's frequently in Washington lobbying on behalf of Parkinson's patients. I would like to thank our speakers in advance. I would also like to thank Janet Davidson, chair of the Adult Education Committee, and the Men's Club, and President Byron Druss for cooperating to bring us this important program.
Let me begin by asking, does anybody here, and if you feel comfortable to say, does anybody here have Parkinson's? Okay. Anybody have relatives with Parkinson's? Okay. So you've seen it, you know something of it. Okay, we're going to go into a little bit more information on it, but I can't tell you how much we really appreciate you all taking your time to come and learn about this. So first off, you see, is Parkinson's disease hereditary? To this, the answer is no. Overall, it's not considered a hereditary disease. Most cases are considered to be idiopathic, which means with unknown cause. But of late, further evidence of environmental genetic causes are being recognized, and it's felt to be 5 to 10% of the cases are due to genetics. And it's not only the genes we'll be talking about. There have been other genes that have been found too. And what is it? Like over the last 10 years or so, right? It really is recent that they found it. Today we're going to look at genetics of Parkinson's disease, the Parkinson's Progression Markers Initiative. Quite a title, huh? So now you understand why we say PPMI. And how can you get involved? And you can all get involved in some way, and we really appreciate you coming. What is Parkinson's disease? We're on to the next. All right. Parkinson's is a neurodegenerative disease, and second most common one after Alzheimer's, and I think you probably all heard that. 1 million people in the United States and 5 million worldwide are living with Parkinson's disease. Motor symptoms are what you think of first, the little tremor or the difficulty walking. That's what you'd think. Mainly, it's just a motor disease. However, more and more we're realizing how many non-motor symptoms are also involved. And they vary. They include depression, memory loss, constipation, smell loss, also other things, sleep issues, weight loss and gain, fatigue, vision issues, dry eyes, dental issues, skin problems, slowness of thinking, dementia, body temperature regulation, writing difficulty, minor difficulties, fine motor difficulties, completing activities of daily living is also difficult. Hallucinations also become a problem as time goes on for many people. So often the non-motor issues are even more devastating than the motor issues. The cause of PD is unknown, and that's what we're working for. That's why we're here. We really feel this PPMI is going to help us find more of the causes and how to move towards treatments and hopefully the cure. As we said, genetics and environmental factors take part, and 5 to 10% of cases are linked to genetic causes. Over the past decade, studies of the genetics of Parkinson's disease have revolutionized the pursuit of this disease-modifying treatment, the great need of Parkinson's patients. We're really looking for this. With our population, they have identified 2 genes, one being, the first is being LRRK2 gene. And it was discovered in 2004. Anytime I'll jump it. Mm-hmm. Okay. LRRK2 is a gene related to the onset and progression of Parkinson's. It is most common genetic contributor to Parkinson's disease known today. And because we've been looking at this one for a long time, the other one just showed. Having mutation of the LRRK2 gene is more prevalent in some ethnic groups. Estimates vary, but 15 to 20% of PD cases in the Ashkenazic Jewish population are attributed to the mutation of this LRRK2 gene. This percentage rises to 30% when there is also a family history of Parkinson's. Each individual who carries a LRRK2 genetic mutation has a 50% chance of passing the mutation on to each of his or her children. Now, mind you, that's passing the gene on. Passing the gene on does not mean the person develops Parkinson's. A very small number of those people will develop Parkinson's. The second gene involved is GBA, which you may have heard of before. Anybody heard of Gaucher disease before? And when early on you took tests before considering having children, you took the test for Tay-Sachs, you also took it for Gaucher. Well, they've now found Gaucher is connected to GBA, and now they realize, it's also connected to Parkinson's. So that's why it's just recently become part of this study. Having the mutation of the GBA gene is more prevalent in some ethnic groups. Approximately 20% of people of Ashkenazi Jewish descent who also have Parkinson's disease versus approximately 7% of people with Parkinson's disease who are of other backgrounds. So there's a larger number. Each individual who carries the GBA genetic mutation has a 50% chance of passing this gene on. But again, it doesn't mean the person who has the gene is going to develop it. Really. And often I've suggested to people, make sure your vitamin D is up, because that's one of the signs of Parkinson's. So if you keep your vitamin D, at least keep that up. Do things that you can do and keep active.
Can I interject
Yes.
for a second? So just to be clear, if you remember back to your high school biology class, when you learned about genetics, so you get 50% of your genes from your mother and 50% of your genes from your father. And Gaucher means that you have a mutation in both copies of the GBA mutation. So both your mother and your father are carriers of the GBA mutation, and you got the mutated copy from each one. That would mean that you had Gaucher. What we're going to talk about for this study is a group of people that have a GBA mutation in one copy that they either got from their mother or their father. People that probably don't even know, because why would you even really know that? Because If you only have a mutation in one copy of your gene, then you're not experiencing any symptoms or there's no disease that comes from just having the mutation in one copy, except that it slightly increases your chance for Parkinson's disease, and that's really important, and we need to understand that relationship further. So that's why this is a group that we're going to be reaching out to for the study that we're about to tell you about.
We're on to why are LRRK2 and GBA genes so important to the research, and I think you've sort of been picking up the idea as we've been going along. So the mutations in both the LRRK2 and the GBA are related to the onset and progression of Parkinson's disease. However, the majority of people, as we've been saying, who have either of these mutations do not go on to develop Parkinson's. By studying people with and without Parkinson's disease who have either the LRRK2 or the GBA mutation, researchers can, and look at what they can find out. These are really the important points. Better understand why some people go on to develop PD and others do not, as they just study how it's going with everybody. They'll be able to track more subtle symptoms of PD before the onset of the motor symptoms. I'm not sure how many of you people know that when people are first diagnosed with Parkinson's, when they first get that tremor, or maybe their foot isn't working as well as they can, that wasn't the beginning of their Parkinson's. They've probably had it for 10 years prior to that. And the most important thing with Parkinson's is the dopamine. By the time that finger is wiggling or the leg or whatever, they've lost 60 to 80% of their dopamine by then without even realizing it. Some things they may have had happen and didn't think about it. Constipation precedes all this very often. Lack of smell, a change in your ability to smell. Also, sleep problems precede this. So what they're looking to do is when they can see these people who have this gene, they can watch and see when are those other things happening. And at some point, we're hoping, when they can really see when it's starting, and then we have to find something. They're working very hard to find different kinds of vaccines and things, zap that. And, these are the kinds of things we're looking for, and we, as a Jewish population, could help them. That's why we're here. So, off my bandwagon. We can also enhance understanding and development of the new treatments for all people with Parkinson's, not just those with a genetic form, because they'll learn from this and it'll go for the whole population. And contribute further to the ongoing genetics revolution in Parkinson's disease research and pursuit of that cure. So I can't tell you how important it is for you to share this information with everybody that you know. You may know people who don't have any connection with it, and you have letters on your tables that you can just scan and send to everybody. Make them aware, because the more we need a lot of people to do it, because just signing up doesn't mean the people are eligible. It takes a lot of people in order to get the eligible few.
Can I interject?
Yes.
I just want to emphasize one point that Myra said that's really important. On an earlier slide, she told you that only 8 to 10% of Parkinson's disease cases are known to be linked to a genetic cause. So as we begin to tell you about the PPMI study, you might be wondering why we're spending millions of dollars and a whole lot of time and energy to recruit specifically this genetic cohort to the study when it maybe is only going to explain 8 to 10% of the cases of Parkinson's disease. And I think one of these bullet points is really important, and it says that if we can understand why two people that have a LRRK2 genetic mutation or two people that have a GBA genetic mutation that are similar, but one of them goes on to develop Parkinson's and the other doesn't, if we can get to a place of understanding with that, like what is it that's triggering the Parkinson's disease in that one person and not the case in the other, then we might actually, from that, really understand things about Parkinson's disease that would apply to, all of the cases of Parkinson's disease, not just the genetic causes. So that's a really important point.
So here's this big Parkinson's Progression Markers Initiative. And just another aside about what this is, in so many kinds of diseases, like heart disease, things like that, you have tests that'll determine what cause, that you better be careful because you're going to have a problem with your heart, you're going to have a problem with your blood pressure or whatever. There are tests for that. Well, as Michael J. Fox says, the only test for Parkinson's typically is what you take if you're a drunk driver. This kind of this, it's all motoric. So they're looking for a good form of finding what precedes it. So we don't, to find the markers. So just makes more sense out of Parkinson's Progression Markers Initiative. And it's a mouthful. I still can't always get around it. So it's a landmark clinical study to better understand this progression of Parkinson's disease. The goal is to identify the indicators of PD progression with the goal of earlier diagnosis, to one day treat motor symptoms sooner or even prevent their onset, to better disease tracking they're hoping to help patients and clinicians better manage their treatment regimen, and more efficient testing of new therapies to improve the odds of success and reduce costs and timelines to get more treatments to market. Because truly, the cost of Parkinson's is over the top with all the people who are suffering from it. So, it behooves us to find all these answers. PPMI is an observational study, meaning the participants are not given any experimental drug. PPMI is a $60 million landmark clinical study sponsored by Michael J. Fox Foundation and is taking place in 33 different sites worldwide, one being at Penn. And the success of this depends on finding more volunteers, both with and without Parkinson's disease. So we'll show you right there is the site that you go on to start to get onto it. And we need as many people to visit as possible. Visit that site. The next page, which is somewhat difficult to see, it shows where all the sites are. And you see there's 20 in the United States, 11 in Europe. There's also in Australia. Certainly, as you would expect, we have it in Israel as well.
For any of these big studies that are going on around the world, we get a little competitive. And in Philadelphia, we think, we have a good number of Jews in our area. We should be among the best sites for recruitment to this study. And we are among the best sites. But of course, Boca Raton is exponentially, leaps and bounds ahead of us, but that's okay. In a few minutes, I guess in a minute, when we tell you what's involved in getting into the study and how we're going to ask you to spread the word about this study, remember back to this slide, because what's really important is that we're going to ask you to reach out to all of your contacts, all of your Jewish friends and family members. And I would guess that many of them probably don't live in or near Philadelphia. But the good news is that we have so many sites around the world that are involved in this study that even if your cousin in California wants to be in the study, we probably have a site that would allow that. So don't let that discourage you if your family or friends are in different areas, because we really have a lot of sites around the world.
Definitely. Okay, so we said we definitely need people to take part. And there's no cost at all for this testing. What we're looking, people to be tested will be first-degree relatives, people who have parents or children with it, or sisters or brothers with Parkinson's. Those would be the ones that would take part in the testing. And what's involved? You go onto the website, and you visit the website that's listed there. I can't read it, and it's in yellow on my sheet. Yours too. And take a brief survey. And if you're eligible for genetic testing for the purpose of this PPMI program, you will be contacted by PPMI, a representative, and sent a saliva kit, okay, to provide DNA sample. And it really is very small. Would you like to open?
Yes.
Okay. All the PPMI volunteers who complete the genetic test will receive genetic counseling afterwards at no cost, okay, to review the results of the genetic test. Based on the results of your genetic test, you may be invited to do further testing in the future. What this is, okay, you're going to spit in here, and then you just close this up, put it in an envelope, and send it back. There's a couple papers, of course, to fill out your name and all, so they know whose saliva it is. But that's all there is to it, okay? If you prefer not to get results, you would actually get in touch with Jackie or one of the other area department, what am I saying? You know, the other facilities that are also doing it, and would do it right there. It's all worked out according to their program that if you do it via the web, you will get the results. And some people really don't want to know ahead. So this is another way, and then we'd still be able to find information out from you, but you would not be provided the information as according to your wish. Okay, I just want to let you know that. Sure.
A second? Can we just go back one slide, actually? Because I think this is important. So at this time, we are specifically recruiting people with Parkinson's disease who are Jewish, who are Ashkenazi Jewish, or first-degree relatives of people with Parkinson's disease. So that would be siblings, parents, or offspring of someone who has Parkinson's disease. So for those of you who raised your hand in the beginning to say that you have a family member with Parkinson's disease, if it's your first cousin, then we're not going to ask you yourself to get involved in the study, but we're going to ask you to reach out to your aunt or your uncle or your cousin's siblings.
Or your first cousin.
Or your first cousin who has the disease. When we recruit from our center, from the Parkinson's patients that are coming in to see us in Philadelphia, we start with the patients. We start with the patients who are Jewish in our clinic, and we tell them about the study, and we say, we'd like to start by having you go through the genetic testing, okay? And if you test positive for either the LARC2 gene or the GBA gene, then we're going to invite you to be in our study, and we're going to invite you to talk to your first-degree relatives about having their genes tested and about them being in the study. Okay, so when we recruit from our center, because we're in contact with Parkinson's patients, that's how we do it. But when we recruit from the community, we really are saying to Jewish people, listen guys, because I'm Jewish too, we need to reach out to anyone in our family or any of our friends who has Parkinson's in their family. And we need those families to get involved. We need the patient, we need the first-degree relatives, we need, really we want the word spread to families. So that's what we're going to ask you to do in any way that you feel comfortable doing it. We've provided you letters on the table that basically say, I went to this great talk and I learned about this great study and, please look into it and see about getting involved. And you're welcome. I apologize for some of the copies that are not perfectly clear, but the idea is that you would send something like this, either by letter or if you wanted to scan it and send it by way of email, that you would send this out to all of your contacts. And I did this when the study first was up and running. I sent an email to to my parents, to my aunts and uncles, to, pretty much anyone in my family or anyone that I knew that was Jewish that was maybe like a generation above me, saying, you guys must have peers who have Parkinson's. Please forward this email on and have those people get in touch with me. And sure enough, I sent the email to maybe like 15 or 20 people, and they each of them forwarded the email to another 20 or 30 people. And so all of a sudden, I started getting emails back from people that I didn't know, that, I had never met before. But a friend of my father's writes me to say that his mother had Parkinson's, and what can he do? So that's really, that's really what we're asking you to do here, is to spread the word to all of your contacts in the Jewish community, and to invite them to find out about the study and to get involved. And the way to get involved would be to start by going on the website, and you can go on to the next slide, to go on the website first to fill out a survey. And then the survey basically takes down some basic information and gives it to our collaborators at Indiana University. They're the ones that are dealing with the genetic testing aspect of this study. So the saliva kit would come in the mail from Indiana University. You'd, do some spitting, send it back to Indiana University.
That's it.
And then just sort of wait to find out about the results. And there, of course, is genetic counseling that goes along with this from a genetic counselor at Indiana University. They would reach out to you to talk to you about it. Now, people are always a little concerned about what does it mean to find out that I have a LRRK2 mutation or a GBA mutation. So let me say this. First of all, for people who have Parkinson's disease, it means absolutely nothing to find out that they have the LRRK2 mutation or the GBA mutation. It doesn't mean that the disease course is going to be any worse. It doesn't mean that they're more likely to develop, one symptom versus another symptom, or to have cognitive problems, or, to decline more quickly. None of that would be the case for Parkinson's patients. So I don't believe there should be any concern at all for patients who have the disease to go through the genetic testing. Of course, people are always concerned, well, what about my kids? If I find out that I'm LRRK2 positive, then that means my kids have a 50% chance of being LRRK2 positive, and that means that they could go on to develop Parkinson's disease. And that's true. I can't tell you that that's not true. But first of all, if it turns out that one of these people is LRRK2 positive or GBA positive, there's still the overwhelming majority of the time they will not go on to develop Parkinson's. Okay, we're still talking about some small numbers here. So the odds are definitely in favor of them not developing Parkinson's disease. But in some cases, they might. And, I come from the standpoint where I think information is power. And if I had a slightly increased chance of developing Parkinson's disease, I think I would want to know that. I would probably exercise more. I would probably take out more long-term care insurance, and I would be quicker to go see a neurologist if I noticed that I wasn't typing quite as quickly as I used to, or I was having trouble putting on my makeup, or something very subtle. So, I'm in the camp of, don't be afraid of this. Let's embrace it and get as much information as we can. And certainly getting involved in the study is going to be the most powerful way to really take charge of this.
Some questions that are frequently asked is the genetic testing covered by your insurance? It is covered by Michael J. Fox Foundation. Do you need to find out the results of my genetic test to participate? And we did talk about that. Yes, if you do it if you do it through the web, yes, you do find it out. If you prefer not to, you would go directly to Jackie or to one of the other centers. What about the confidentiality of the genetic testing results? If you choose to participate in this study, the information collected during the screening process will be stored or locked under computers and computer servers. Access to these servers is limited to study personnel only. All information that is shared with the PPMI study will be de-identified, no names. It is your choice if you wish to share the results of the genetic test with your healthcare provider or with anyone else. Okay, so here we go back to what can you do? And as we said, first, visit the website and fill out all the information, or else you can call if you don't have the web. You can call and take part. Number 2, share the information, as we have repeatedly told you, with family and friends. And we can't say it enough. We would really appreciate it. We see you as really being our huge helpers in doing this. It's so very important. I might want to say to you, for the study, they need 500 people. Presently, there have been, this was as of November, there were 10,000 people who completed the survey, 1,900 qualified for the test, 170 were found to find the genes, and to carry the genes, and were referred to the PPMI centers. So you see how many people we need in order to get 500. So right now, the LRRK2, we have 88 people who are being followed that have Parkinson's. 68 people are being followed who have the gene but do not have Parkinson's. 4 people that are in the study for GBA. And our hope is to get to 500 by the end of the year. So it takes a lot of people. And I encourage you, really, tell your friends, your family, and please don't let it stop there. Encourage them to do the same. Please.